What are they thinking? The straight facts about the risk-taking, social networking, still developing teen brain by Aaron M. White and Scott Swartzwelder continued. But until the prefrontal cortex has fully matured and these four regions are working together like a well-oiled unit, stresses can cause mood changes, including depression, in ways that are particular to adolescents. As with anxiety, psychotherapy and medication have been shown to be effective in treating adolescent depression. The medication of choice, again, is selective serotonin reuptake inhibitors, SSRIs, which are effective in about 60% of the subjects. An older class of medications, the tricyclic antidepressants, is not a good option for adolescents because they have not been shown to be better than placebo, and the risk of a fatal overdose is much greater than with SSRIs. There are currently 9 different SSRIs on the market and 40 different brand names. Studies have shown all of them to be effective in general, but some work better than others for different people. This is where a skilled psychiatrist comes in. Sometimes finding the right drug and the right dose involves close monitoring and some try and error. The most common side effects, which are often mild and temporal, include gastrointestinal symptoms, headache, agitation, and sleep disturbances. A more rare but extremely serious side effect is an increase in suicidal thoughts. A survey indicated that about 4% had suicidal thoughts, about twice the rate amongst those taking placebo pills. Suicide is the third leading cause of death for people aged 12 to 24. Boys are 4 times more likely than girls to kill themselves, though girls are more likely to make an attempt. The undeveloped nature of teens' frontal lobes and other brain regions interfere with their ability to process stress and other emotions. Urges bubbling to the surface build up sufficient pressure to swarm the cognitive control centers and to lead teens to act in unhealthy ways. During adolescence, the future is measured in weeks, days, and nanoseconds rather than months, years, and decades. As adults, we recognize that heartbreak, rejection, harassment, and conflict with others can sting, wound, and sometimes scar at the deepest level, but that somehow we will get by with the help of friends. This isn't as easy for the adolescents who lack the cognitive maturity to think far into the future, particularly if their entire experience has made them feel as though things will never ever get better. As irrational a choice as suicide might seem to most adults, sometimes is the only action that makes sense to a desperate kid. Anorexia nervosa can be extremely dangerous. Sufferers are obsessed with food and body weight, which leads them to eat less and less and less. Some exercise excessively in their relentless pursuit of thinness. The most striking, disturbing, and incomprehensible psychological feature of anorexia nervosa is the distorted view that sufferers have of their own bodies. They see themselves as fat, though a mirror clearly reveals that they are emaciated. Anorexia nervosa occurs 9 times as often in females as in males, and in about 0.6% of the population. 0.56% of 15 to 24-year-old women with the anorexia nervosa die each year from complications associated with the condition, making it one of the highest mortality rates among psychiatric disorders. There are no clearly known causes of anorexia nervosa. One theory is that it results from a pathological response to the female hormone estrogen, which normally causes mild suppression of appetite. Another possibility is that self-induced starvation itself triggers brain changes that reduce the urge to eat. Biology is only part of the story with anorexia nervosa. We live in a culture that indoctrinates girls from a very early age with the idea that thin is beautiful. We also know that the risk of anorexia is higher in environments and professions that place a high value on thinness, e.g. modeling, dancing, acting, and sports. Because there are so many physical causes of weight loss. The initial evaluation of anorexia nervosa is more medically intensive than for other disorders, and a thorough medical workup, including laboratory tests, is usually a good idea. Once a diagnosis is made, the first priority is to get the person back to the healthy weight, because while the disorder might have a psychological root, the physical effects can be fatal. Once the patient has achieved a healthy weight, the focus of treatment switches from medical stability to individual, family, and group therapy that will identify the issues that led to the disorder and help prevent relapse. The therapy may be valuable in the initial stages of treatment as well, but it is important to tend to the patient's physical well-being. Because depression and/or anxiety often accompany anorexia nervosa, the medication discussed above may be prescribed. However, it should be noted that antidepressant and anxiety medications alone have not been shown to be very effective in treating the core symptoms of anorexia nervosa. Bulimia nervosa, unlike anorexia, in which a person's body weight can be grotesquely subnormal, bulimics often have normal body weight. Rather than refusing to eat, bulimics binge on food and then make themselves vomit, or take large doses of laxatives to avoid absorbing all of the calories. As with other disorders that emerge during adolescence, it turns out that there is a strong genetic component to bulimia. Research has shown that if one twin suffers from bulimia, there is a 60 to 80% chance that the other twin would suffer from it as well. Anywhere from 25 to 75% of bulimics suffer from depression, making antidepressants a treatment option. The effectiveness of antidepressants for bulimia is roughly equivalent to the benefits of cognitive behavioral therapy. It makes sense to utilize a combination of the two approaches. Schizophrenia is a serious illness that causes disordered thinking and unusual behavior. The disordered thinking or psychosis may take the form of hallucinations, which are sights or sounds that aren't there, such as voices that order the listener to do things. Adolescent schizophrenia is often associated with a childhood history of delays in motor or language development, as well as mild cognitive and social impairment. The most common symptoms of schizophrenia are delusions, hallucinations, incoherent thoughts, and odd behavior. Incoherent thoughts may be a breakdown in normal thinking, that often involves jumping wildly from one idea to another. Odd behavior may be long periods without movement, poor hygiene, odd speech patterns like echolalia, repeating things that other people say, word salad, stringing partial sentences together in an odd and often loosely associated way, and neologisms, making up words. It is particularly difficult to diagnose schizophrenia in teenagers, in part because their typical behavior may be anxious, moody, irrational, sad, manic, silent, and distracted. Many conditions other than schizophrenia lead to psychotic symptoms during adolescence, like bipolar disorder, severe depression, and exposure to environmental toxins, etc. Because of its biological basis, schizophrenia is almost always managed with judicious use of medication and sometimes hospitalization. The first line of drugs for adolescent schizophrenia is antipsychotics. But while these medicines are effective in reducing symptoms and helping teenagers function on a daily basis, the side effects tend to be more severe than those of SSRIs and anxiety drugs. The side effects can include substantial weight gain, which adds stress to the life of a teen already trying to cope with a serious psychiatric disorder, metabolic problems, and even movement disorders including akathisia, which is a feeling of inner restlessness and the urge to be in motion. People with akathisia fidget, rock from foot to foot, or pace. Another movement disorder side effect is extrapyramidal syndrome, which can result in involuntary muscle movements or spasm, often in the face or neck. These side effects can be scary and should be a serious concern when treating schizophrenia. But it is important to emphasize that because schizophrenia can lead people to behave in dangerous and self-destructive ways, it is far better to treat the disease and manage the side effects than to let teens go without treatment. Because there are not yet any laboratory or imaging tests that can definitively confirm a diagnosis of schizophrenia, depression, or other psychiatric disease illness in either teens or adults, the diagnosis depends on tracking a pattern of symptoms and behaviors. When parents and experts work together closely, it's often possible to identify problems early on, when treatments can be most helpful. We eat to provide our bodies with energy. The energy bonds between the molecules found in food are used to generate the fuel utilized by every cell in the body. In addition to vitamins and minerals, we extract three basic components from the foods we eat: carbohydrates, fats, and proteins. Each plays an important role in brain function. Carbohydrates consist of simple sugars, such as sucrose found in table sugar, and complex sugars such as starches found in vegetables. Complex sugars are composed of chains of simple sugars. Carbohydrates are a good source of quick energy because they can be converted rapidly into glucose, the body's preferred energy source. Fats come in two forms: unsaturated and saturated.
Low battery, please charge.
Unsaturated fats are extracted from nuts, fish, olives, and vegetables, and generally are healthier than saturated fats, which come from meats and dairy products. Fats can be converted to glucose, used to make hormones, or stored for fuel. The brain itself is more than 50% fats. Proteins are made up of amino acids which are used to build new cells and repair damaged ones. Amino acids are also used to build neurotransmitters such as serotonin and dopamine, two of the neurotransmitters most closely linked to mood regulation and feelings of pleasure. In addition, amino acids make up enzymes in the brain that play a critical role in breaking down molecules when they are no longer needed and putting together new ones. There is no bodily process that does not depend upon nutrition. Because of its rate of development, particularly in the frontal lobes and related circuits, the adolescent's brain requires all of the energy and metabolic resources provided by good and balanced nutrition, and suffer when it doesn't get what it needs. The brain mechanisms that regulate eating and body weight are only partially under our conscious control. The hypothalamus controls the balance between the amount of food energy we take in and the amount of food energy we use or store. It also monitors the levels of circulating hormones related to eating and energy storage, making us feel more or less hungry and slowing or quickening our metabolism accordingly. While activity in the hypothalamus is beyond our conscious control, we are nonetheless able to choose when to eat and when to stop, thanks to the decision-making power of our frontal lobes. We can also influence how much stored fuel we burn by deciding how often and how hard we exercise. Although the brain and the rest of the body use glucose as a primary source of energy, this does not mean that eating a lot of sugar is a good idea. It must be done in moderation. The United States Department of Agriculture advises adults who eat a 2,000 calorie diet to limit sugar consumption to about 10 teaspoons of added sugar, above and beyond those that occur naturally in foods like fruits per day. A teenager male who follows a healthy diet can eat about 18 teaspoonfuls of added sugar, according to USDA. A can of Coca-Cola contains 9.29 teaspoonfuls of sugar. When a person consumes a high dose of sugar, such as a can of Coca-Cola, the pancreas releases a large amount of the hormone insulin in order to move the sugar out of the blood and into the cells where it can be used as fuel. Insulin also converts any extra sugar into glycogen in the liver where it is stored. When a big load of sugar bombs into the bloodstream, maybe after that Snickers / Coke combo, so much insulin is released and it works so quickly to make the sugar out of the blood and into the tissues that the blood sugar level actually decreases very rapidly. As a consequence of the drop in blood sugar level, it becomes harder to pay attention and to keep information active in short-term memory. The drop also triggers the adrenal glands to release adrenaline and the stress hormone cortisol. Cortisol causes the liver to convert the stored glycogen back into glucose, which temporarily brings blood sugar levels back up again. This is a dangerous roller coaster ride, and repeating it too frequently or with very large sugar highs and lows can result in insulin resistance and the onset of type 2 diabetes. As the cycle repeats, the body learns to ignore the insulin signal set off by massive sugar intake, and the insulin can't get sugar into cells or store fuel as glycogen. The excess sugar gets stored as fat. Rapid rises and falls in blood sugar levels drain the brain. After a sugary snack, neurons get all fueled up, and this causes a temporal improvement in concentration and memory. However, Because the neurons can't store glucose for later use, the subsequent insulin spike and fall in blood sugar levels leaves neurons starved for fuel, and fatigue, weakness, and in some cases nervousness sets in. High fructose corn syrup, or corn sugar as it's called by the companies that produce it, also poses problems for the brain. The hormone ghrelin, which is secreted by the stomach, tells the brain we need food. Another hormone, leptin, released primarily by fat cells, tells the brain we've eaten enough. The sugar in natural foods suppresses ghrelin release, decreasing the hunger signal, and increases release of leptin, signaling us to stop eating.